Hello everyone, welcome to Just Med Talk. I am Syed Mohsin. I'm a practicing pharmacist in a tertiary care hospital. We're talking about something that honestly doesn't get enough attention in pharmacy school. We are diving into non-clinical skills, which are very essential to survive you as a practicing clinical pharmacist. It does not sound as exciting as pharmacokinetics or drug-drug interaction, but here's the thing. Whether you are studying for boards right now or already working in a clinical practice or just trying to figure out what comes next day, stay with me on this one. Pharmacy has changed dramatically, right? So think about, we are not just counting pills or fixing label on bottles anymore. We are making clinical decisions, we are solving complex problems, and we are leading the healthcare teams. And that shift, it requires way more than just knowing your drug information. The American College of Clinical Pharmacy actually breaks this down into 4 major domains that every clinical pharmacist needs to master. First, there's communication. I mean real, effective communication, not just talking to the people. Second, advanced cognitive skills. Basically, how you think through problems and make decisions. Third, professionalism and emotional intelligence. Yeah, that's touchy-feeling stuff that actually matters way more than you think. And last, system-based practice. Understanding how healthcare systems work and how to improve them. Here's what's important. These aren't just nice to have soft skills. They are measurable, they are teachable, and honestly, they are how you actually translate everything you learn into school into real impact on patient care. So alright, let's talk about communication first, because this is where a lot of us struggle without even realizing it. Here's a wild stat for you. Nearly 9 out of 10 adults in the United States have trouble understanding basic health information. 9 out of 10. That's not a small problem. That's a massive barrier to care. And guess who is the perfect position to fix it? Us pharmacists. So here's a game changer I want you to try. The teach back method. Stop asking patients, do you understand? Because everyone just say yes when they don't. Instead, flip it around. Let me give you a real example. You're counseling a patient on warfarin. Instead of saying, do you understand why you need to avoid eating too much leafy greens? Instead, try this. I want you to make sure I explain this clearly. Can you tell me in your own words what foods you will need to watch out while taking these medications? Now the patient might say, oh, you mean I can't eat salads at all? And boom. You just got a major misunderstanding before they left your pharmacy. You're checking yourself and it works. So there's actually a framework, the 5 T's. Triage the situation, use the right tools, take responsibility for clear communication, tell me back what you understood, and if needed, try again. Does it take a little extra time? Sure, but it prevents medication error, hospital admissions, and potentially saves lives. And here's the thing, communication isn't it just about patients. You are also working with doctors, nurses, other pharmacists, residents. Picture this, you're on morning rounds and you need to recommend switching a patient from IV to oral antibiotics. You could say patient should be switched to PO, or you could say that patient has been afebrile for 48 hours, tolerating oral intake well, and this white count is trending down. I would recommend transitioning to oral therapy to reduce line infection risks and potentially facilitate earlier discharge. See the difference. One builds credibility and trust. Whether you are on morning rounds, writing a consult note, or presenting a case, and how you communicate shapes whether people trust your recommendations. Talking about critical thinking and clinical reasoning. This is the stuff happening in your brain when you are working through a patient's case. You can memorize all the guidelines and drug information in the world, but in the real world, you need to actually apply that knowledge. You need to think critically, challenge your assumptions, and adapt on the fly. Our brains love shortcuts. They are called heuristics, and honestly, they are usually helpful, until if they are not. Let me give you some real life example. Confirmation bias. A patient comes in with nausea and vomiting. You see they are on chemotherapy and immediately think, oh, it's a chemo-related nausea. So you recommend increasing their antiemetics. But you did not ask about the other medications. Turns out they have just started degoxing last week and the level is toxic. You only look for information that confirmed your impression first. Or there's something called anchoring bias. The ER doctor tells you a patient is having an acute COPD exacerbation. You anchor on the diagnosis and recommend steroids and bronchodilators. But if you look at the whole picture, the patient also hypotensive, febrile, and has a productive cough. Maybe it's actually pneumonia with sepsis and they need antibiotic stats, not just respiratory medications. These mental shortcuts can lead to serious clinical errors. So what's the fix? Metacognition. That's just a fancy word for thinking about your thinking. Step back and ask yourself, am I being objective here? Am I missing something? What assumptions am I making? Here's what I do. Before I finalize a recommendation, I literally ask myself what would make me wrong. It forces me to look for contradicting information, use intellectual standards, clarity, accuracy, precision, relevance, and objectivity. And don't be afraid to use technology to help. Clinical decision support tools, automated systems, they are not crutches. They are partners. They reduce cognitive overload and help you make better decisions. Recognizing and mitigating bias isn't it just some academic exercise. It's literally a patient safety strategy. Third most important non-clinical essential skills: professionalism and emotional intelligence. I'm not just talking about showing up on time and dressing appropriately. Real professionalism is about integrity. It's about leadership. It's about putting your patients first even when it's hard. It's about stewardship, mentoring the next generation, advancing the profession, and committing to never stop learning. But here's what nobody tells you in pharmacy school. Emotional intelligence might actually be your most valuable skill. Emotional intelligence, or EI, is what helps you navigate tough conversations with patients or other healthcare providers. Let me paint this picture. You're working with a physician who keeps ordering medications that are contraindicated for patients. You have called 3 times already. You could march up them on the unit and say, "You're prescribing these wrong medications. Do you even read my notes?" That's a low emotional intelligence, defensive, accusatory, and guaranteed to make them ignore you forever. Or you could use high emotional intelligence. "Hey doctor, I know you are very busy today. I wanted to touch you about patient's case. I'm concerned about the interaction between her new medications and her renal function. I pulled some data that might be helpful. Do you have 30 seconds? You're acknowledging their workload, framing it collaboratively, and offering a solution. That gets result. High emotional intelligence actually drives your continuing professional development, and when you are self-aware and motivated, you're more likely to stay certified, stay current, and stay effective in your practice. So last piece, system-based practice. This is where you zoom out from individual patients and start thinking of the bigger picture. Clinical pharmacists are change agents. We don't just treat patients one at a time. We shape processes, improve systems, and influence outcomes on a larger scale. What does that mean? This means getting comfortable with things like pharmacy informatics, quality improvement initiatives, and policy advocacy. Ever heard about PDSC cycles? Plan, do, study, and act. Or lean methodology, Six Sigma. There isn't it just business school buzzwords. They are tools we use to optimize patient care. Here's a concrete example. Let's say your hospital has a problem with delayed antibiotic administration in septic patient. You notice it's because pharmacy does not get notified quickly enough. You join the sepsis committee, you map out the workflow, and you identify that delay happens in the order entry processes. Then you plan a solution, maybe implementing an alert system that notifies pharmacy immediately when sepsis criteria are met. You do a pilot on one unit. You study the results, turn out to be first antibiotic dose drops from 90 minutes to 25 minutes. Then you act. You roll it out hospital-wide. That's a PDSA cycle in action. Your ability to manage workflow, drive change, and advocate for pharmacy makes you an indispensable part of the healthcare team. So here's my bottom line. Non-clinical skills aren't optional extras. They're absolutely essential. That's how you turn knowledge into real-world impact. If this resonated with you, do me a favor. Hit that like button, subscribe my channel if you haven't already, and share this with your pharmacy friends. And drop a comment below. I would love to hear from you. Until next time, keep learning, keep growing, keep pushing pharmacy forward. See you in my next video. Have a nice weekend.